Yeah, so the first name is Richard. Last name is Carvolth, Chief Physician Executive, Dignity Health, Greater Sacramento.
Got it. So you're an ER doc, but you're also involved in administration.
That's correct.
Okay.
Yes.
Talk to me a little bit about how capacity works for a hospital. How does it work when you have this sort of anticipated event where you're going to have this influx of patients? Because my understanding is that most ERs are running about, and hospitals are running about 90% capacity on a daily basis.
Yeah, that's so the ERs are running at full capacity usually all the time. We do tailor our staffing to our capacity, so we have a pretty good idea of how to anticipate day-to-day capacity, and we're running over 90% typically. And the inpatient side, pretty much the same thing. We don't necessarily use every single bed in the facility, but we are staffed to capacity. So our normal state is staffed to capacity for the volume we expect. So if, for example, our hospital is 300 beds, we might be staffed at 270 beds on a regular basis. We do have some additional capacity, physical capacity, but we're not staffed to that. So when we are anticipating a surge, we not only have to use all of our physical capacity, but we also have to staff up to that. And in addition, when we are facing an unprecedented pandemic, we're not sure we're going to have enough physical capacity either. So that will become a challenge not only for Dignity, but for all of the health facilities in Sacramento and in California.
Yeah, I mean, so that's sort of business as usual, as hospitals are pretty much keeping themselves full.
Pretty much, yes.
So I understand that hospitals do have pandemic plans and supplies. So there are, I mean, do you have tents? Is there like a whole thing that springs into action if you start to get a crush of these patients?
Well, we do. Every hospital has a disaster preparedness plan, and those are for even sort of more routine disasters where you might get multiple car accidents or other types of incidents where there are significant numbers of patients coming to your facility. But we also have preparedness for major events such as earthquakes and other events. But again, the COVID-19 pandemic is going to test everyone. It is an unprecedented, we anticipated being an unprecedented event.
Yeah. Have you started to see an uptick yet at your particular hospital, or you're just kind of this the calm before the storm sort of thing?
We're still, I think, in the calm before the storm. We have low numbers of COVID positive patients. At Dignity Health, we have seen a few, and we have a number that of patients who are what are called persons under investigation. So we have suspicions that they may have COVID-19, but they're in the testing process.
Got it. I know tents are a part of that sort of expansion plan for a lot of hospitals. Can you speak to sort of the difference between a tent and an ICU?
Oh my gosh. A tent is really designed to be a low-level acuity screening process. Most of our facilities do have tents. Some of them are already up and ready to go. Some of them are just in the readiness stage and are not deployed at this point. The tents are really designed to help keep our resources intact in our hospitals and to allow us to screen patients primarily who need to be screened, have low acuity, and can be assessed in a tent environment, which is nowhere near the intensity level of an ICU or intensive care unit. So you should think of a tent as really kind of a step-down unit from the emergency department. We can screen folks who might or might not have COVID. We can also treat minor issues. But if patients need more significant care, they would be moved into the emergency department and then ultimately into the hospital. And then if they really have very intensive needs, only then would they move into the intensive care unit.
Got it. I know one of the big concerns is about ventilators. If you have very severe symptoms of COVID, you might need to be, is that intubated and put onto a ventilator? How are you thinking about that? I mean, are you anticipating having to get to a point where you're gonna have to decide who can get one and who can't?
Well, thankfully, we're not at that point, anywhere near that point at this point. But we do know that certain patients do become critically ill and do require respiratory support, which is a ventilator. We do have many, many ventilators throughout our 6 hospital healthcare system. Um, San Juan is one of our primary, Mercy San Juan is one of our primary facilities. We have many ventilators there. And we're doing a few things to make sure that we have plenty of ventilators. So for example, we're beginning to defer or reschedule elective surgeries that could be put off for 30 to 60 or 90 days, so that we are creating capacity in our hospitals. That will help preserve staff and equipment, including ventilators. We also have orders out for additional ventilators, and there's possibility that we could even use rented ventilators. But remember, Dignity Health, like our sister healthcare institutions in Sacramento, will be facing this pandemic together. So there may be a shortage of ventilators across the city or even across the state. One other thing to keep in mind is that as we scale down to prepare for this surge, we have ventilators that are typically used in our operating rooms that can be used to support patients. We have post-anesthesia care units where patients go after surgery, which have ventilators that we can use. We also have outpatient surgery centers, again, where there are ventilators that can be used to support patients. So we think that we are well prepared and we can marshal our resources to what we're anticipating seeing in a surge.
What's the backup plan to the ventilator, though, if you do end up in that shortage situation? Like, what's the most you can do for a patient if you don't have one of those?
So if a patient needs a ventilator, they need a ventilator. So they're really, in terms of a backup plan, what we're doing is we have an advisory group to the governor, actually, and to the California Hospital Association and the CMA. We have been in talks about how either the National Guard or even military folks can help us. So we have military bases. Travis is well known, and their bases in Southern California where there are medical facilities. So we're going to be looking at every type of facility that can help all of us in the case that we get to that surge level.
Yeah, got it. So if you need one, you need one, is what you're saying. Got it.
Yes.
I've been hearing from doctors in hospitals in the Sacramento region. I don't know if this applies to you, about a shortage of these N95 masks. And I'm curious if you guys are experiencing that there. And if you have any thoughts on this guidance the CDC had to put out. I know New York's had a big shortage, telling doctors if you don't have one, use a face shield or bandana in worst case scenario.
So right now for Dignity Health, we are not facing shortages of N95s. The N95s have a very specific purpose, and that is for airborne illnesses and to prevent airborne spread. We have learned, and the CDC has provided us guidance, that this disease is spread by droplet and contact means and not airborne means. So that has relieved a lot of the need for use of N95 masks. And frankly, plain surgical or ear loop masks are adequate in most situations. What we do know is in certain cases, certain procedures like bronchoscopy and other respiratory procedures, the virus may be aerosolized. And in that case, N95s are necessary to protect our workers and our physicians. So we are marshaling those resources very carefully. And we think actually that the N95s are likely not to be what's in the most short supply, but really just plain old surgical masks.
Yeah, got it. As a doctor, I'm wondering if you can address this issue of the super mild symptoms. This might get a little bit at the telehealth announcement that your company made today, but the concern here is that people may have this and not even really think twice about it, might confuse it for allergies, might confuse it for just mild sniffles. but then, go out and about and infect other people. So, I mean, at what point is it worth seeing a doctor at all versus just, hiding yourself away?
So that's a very good question. It's a very good point. And it's the whole reason that we are moving not only to mitigation or care of patients that potentially have COVID or do have COVID disease, but continuing the containment efforts, the shelter at home and the other, the social distancing, all the efforts that we're making and asking the public to make is precisely that. People don't know if they have the virus. They don't know because they're asymptomatic. They may have, and we know it's in the community, so it doesn't require travel anymore. So that's a very important point. We are asking people to follow these measures so that we try to mitigate the spread of the disease or contain it better. So the second part of your question was, so what do I do if I think I might have?
I'll use me as an example. I was in a commercial flight on Sunday to come home early from a trip. I've got a little tickle in the back of my throat. I've got a little bit of sinus stuff going on.
Yes.
But, I can't just go out to a drive-through test where I live. So is it worth me doing a televisit at this point, or should I wait until I get a fever?
So, yes, so that's a very good point. There are many respiratory illnesses right now. It is wintertime. It's still the end of the flu season. So there are multiple viruses that can cause respiratory symptoms. And in fact, in most cases, when people are ill with a respiratory illness, we test for those viruses first. Because if we know that the patient has a flu virus or some other virus, then we don't have to worry about coronavirus in that patient. If you are symptomatic, the best thing is to contact a physician or a healthcare provider who can advise you on the likelihood of your having coronavirus. And if it is likely, direct you to a testing center. So it is not why, and we're discouraging people from simply going to the emergency department because they think they might be sick. If we do that, we're going to overwhelm our emergency departments and our hospitals, and we won't be able to care for everybody.
Got it. And to that end, Dignity is offering these free remote visits.
We are. So as of actually today, we are offering visits called Virtual Care Anywhere. It's available to anyone, not just Dignity Health assigned or patients that are part of our population health program, but anyone. And it's available through a website, which I can give you the reference for a little bit later. It's also available, or you may have it. It's also available through a mobile app through Apple and Google. And there you will connect to a provider, pardon me, who will assess your likelihood of Corona-19 or COVID-19, and then advise you where it would be best for you to seek further care, including testing.
Yeah. One thing I'm hoping you can kind of address is maybe give like a little medical perspective to this, but a lot of companies out there are telling their employees, we'll give you a week or two of sick time if you test positive, but we have this shortage of tests, right? So I think a lot of people may be interested in your service to, oh, you know what, I want to make sure that I'm confirmed even if I'm not that serious, but right now is not really the time for that. Like if you're doing okay, you probably don't need this. Just stay at home. Would that be your message?
That is the message. We don't need to test everybody. Many people have very mild illness with this coronavirus, milder even than the flu, and simply recuperating at home and overcoming the illness on their own is sufficient, and they don't need to be tested necessarily. And there is a shortage of testing. So we do want to reserve testing as much as possible for people who are significantly ill, and particularly those people who are getting worse, so that we can get them to the right level of care.
Okay, now talk to all the bosses out there who are setting that policy that says, show me your positive test to get your sick time.
Well, these are unusual times, and we're all going to have to deal with that.
But I mean, in all seriousness, like employers shouldn't be encouraging people to go out and try to get this test because they are short, unless they have serious symptoms, right?
That's correct. That is correct. And frankly, there is guidance in our own organization. We're giving guidance that if you're having respiratory symptoms and you can shelter at home and you recover from your symptoms, you don't have to be tested necessarily. We have specific guidelines about you need to be at least 7 days from the onset of your symptoms, and you need to be at least 3 days from the recovery of your symptoms. And if you're well at that point, then you can come back to work. And you don't have to demonstrate that you had a positive COVID test.
Got it. So business owners and bosses out there might think about adjusting their plans to be something along those lines.
Exactly.
Okay, cool. Any reaction to this, and I'm almost done here, but any reaction to the governor saying that he expects 56% of the state to get this? I think that is going to open a lot of eyes to that. People might be worried.
You know, there are many projections about how widespread this may come. I personally think that's a worst case scenario, but we ought to prepare for the worst case. The governor has lots of good analytic capability, but still it's based on what we know of this disease and how it's evolved in other countries. It's a evolving science at this point. I think it will become clearer and clearer over time what the trajectory of the illness will be, what the peak of the illness will be. And I don't think we know that for sure at this point. I think the governor is preparing us for a worst case scenario.
Got it. I mean, does the worst, frankly, just from your perch as someone who's working in an ER, does the worst case scenario look like our hospitals get overrun?
We could easily test the capacity of our hospitals, yes. But we need to have alternative sites for treating patients, including tents. We've also talked about, as you know, the military has 1,000-bed ships, hospital ships, one of which is being deployed to California. We're also looking at some hospitals that have recently closed that may become available to us that we could, when I say we, I mean the state, could stand up quickly. And there are medical capabilities within the military, the Army, the Navy, and certainly the National Guard. So we will be looking at all of those resources to care for the population, if in fact we do get to the point where our existing hospitals are overwhelmed.
Got it. I mean, this looks a little bit like the dermatologists are becoming all hands on deck and treating COVID patients, right, at some point.
Well, we're looking at all hands on deck. We're looking at, in fact, I had a recent conversation with the California Medical Association, and we're looking at all of the recently retired physicians and nurses and other folks who could easily come back into service and help us all out. So there's a reserve of folks, I think, who will be able to help us staff up.
Got it. Have you seen anything in your career that comes close to what you're bracing for right now?
Well, you know, we had H1N1, and that was not a walk in the park, frankly, and we managed through that. I think this has the potential to be bigger, but we will get through this. It will be challenging, but there are many dedicated folks and institutions, and we have reserves and we have technology. I'm confident that we will get through this, as difficult as it might be.
Anything I didn't ask you, you want to make sure you get across? I think it's getting lost in the conversation. Right?
I think it's very important that people not panic. I think it's very important that people contact their regular healthcare provider if they feel like they're sick or they have questions, or they can use our virtual care anywhere. But it doesn't help to panic. There are resources out there. We will take care of patients. We will be okay.
Very good. Well, I appreciate you taking a few minutes. I'd love to do it again sometime throughout all this, but good luck to you and everything you've got coming ahead.
Okay, thank you. Thanks for inviting me.
Yeah, no problem. Take care.
Okay, bye.
All right, bye-bye.